Welcome back to the Caribou Daily Side channel. It is the evening of Friday, November 6th. I'm getting ready to run my daily reports. Sorry, a little late, but other activities kind of took precedent over these daily reports today. So let's begin with the U.S. since that's the first one that popped up here. Well, of course, we run in my weekly prediction model tomorrow. As you can see here, that currently the U.S. is averaging 33,020 cases per day, but only 928 deaths. The current average mortality rate is 3.2%. And if we look down here, here's the 3.2, the red. Look at how many days are below the. Look at how many days the mortality rate was below the average. Now, this should be no surprise. The cases have been continually climbing upward since April. Never really dropped back down. Deaths are more interesting now. And you can see we had this huge spike here, and I figure if the news media can quote a single day high, then I can quote a single day also. So this is sometime around April 13th, 14th, 15th. You can see that the deaths are over 4,500, close to 5,000 deaths for a single day, all the way back down to under 500 deaths per day here. Okay, because this is, well, that's not right. It's close to 800. We know 800 deaths today, but that still is well below this number here. Okay, and it's well below this number here, and it's way below this number here. Anyway, we look at it. So let's zoom in. This is no surprise. This should be the mortality rate according to Washington University's Institute for Health Metrics and Evaluation. This is a 17 to 21 day incubation period, which means everything to the left of this should have already been taken into account in terms of cases and deaths. Okay, the deaths should have already occurred for this section back in here. But as you can see, if we zoom in here on deaths, you can see the deaths are climbing up to about 1,000 here. Although that's a daily number, not an average number. Uh, but it still has a way to go to catch up to here, certainly up to there. Now, the red line is the average number of cases per week. These are the cases. This is a continuing issue, although I'm not sure it's really that big of an issue. Cases, of course, because according to, once again, Washington University's Institute for Health Metrics and Education, deaths are the most important measure of a pandemic's spread. Not cases, not hospital beds, but only deaths. Okay, look at this. This is the average number of deaths per week here. This is 5. This is 7,500. So you can see here. Look at all these weeks when these numbers were below the average, when deaths were below average. Cases, of course, should be no big surprise. This is we know that cases are spiking. Interesting enough, it did actually decline in August and September. Did actually decline. And we're up here to this is the current months. Uh, Deaths, you can see, have remained fairly low, about 20 to 22,000 here. It did spike back up here, but you can see what's going to happen. So anyway, so I would say the news as far as U.S. is still good. Cases are still remaining incredibly low. Mortality rate is what 3%. So let's just go ahead and just update my database here for this one, and we'll move on to the next report. So that takes care of the COVID-19 analysis for November 6th for the country, for the U.S. Let's move on just 1 second to the other